Today's topic is about reversible and irreversible pulpitis. The causes of pulp disease are physical, chemical and bacterial. Pulpitis can be developed from caries and it extend into the pulp, which leads to pulpitis. Pulpitis is an inflammatory disease of dental pulp. Definition of pulpitis. It is the inflammation of the dental pulp resulting from untreated caries, trauma and multiple restorations. Next is about sequelae of pulpal diseases. After removing the stimuli and give proper management to the pulp will usually bring back the pulp back to a healthy state in reversible pulpitis. If reversible pulpitis is untreated, it may lead to irreversible pulpitis. Irreversible pulpitis cause chronic hyperplastic pulpitis, symptomatic and asymptomatic irreversible pulpitis, and may cause internal resorption. Reversible pulpitis is a mild to moderate inflammatory condition of the pulp caused by noxious stimuli. It may be caused by any agent that is capable of injuring the pulp. Trauma, thermal shock, chemical stimulus, placement of a fresh amalgam filling in contact with or occluding, these are the causes of reversible pulpitis. Excessive dehydration of a cavity or irritation of exposed dentin also may cause short, sharp pain lasting for a moment. The pain is instantly relieved on removal of the pulp. Cold, sweet, usually causes this. The best treatment for reversible pulpitis is prevention. Periodic care to prevent the development of caries. Early restoration done if cavity developed. Irreversible pulpitis is a persistent inflammatory condition of the pulp. It may be symptomatic or asymptomatic. The most common cause of irreversible pulpitis is bacterial involvement of the pulp through caries. Asymptomatic irreversible pulpitis may develop into symptomatic irreversible pulpitis if it is untreated. In the early stage of irreversible pulpitis, a paroxysm of pain may be caused by sudden temperature changes, particularly cold, sweet or acid foodstuffs. The patient may also complain of postural pain, that is, change of position, if bending or lying down. This is due to the increase in intrapulpal pressure when the patient changes position. Patients are often kept awake at night by the pain, that is nocturnal pain. In radiograph, cavity may seen with the exposure of pulp. Complete removal of the pulp or pulpectomy is the treatment for irreversible pulpitis with medicament filling. Surgical removal should be considered if the tooth is not in restorable condition. Characteristics. Features. In reversible pulpitis, pain is sharp and short in duration. It's relieved on removal of stimuli. But in case of irreversible pulpitis, the pain is spontaneous, continuous, lingering or nocturnal. If you like this video, please subscribe our channel and support us.